Heart disease is still the number one cause of death for Americans, and research shows that Black Americans are 54% more likely to die when compared to their white counterparts. Dr. Richard Ferguson is the president and founder of Black Physicians of Utah. He joins me now live. Thanks for being with me today.
No, thank you for having me.
Dr. Ferguson, why are African Americans seeing a higher rate of heart disease?
So we have to remember that the number one killer of all Americans is heart disease. And just to put a little perspective, the rate of disease has been decreasing since the 70s, but just not as sharply for African Americans. But Black Americans don't necessarily have more heart disease, but are more likely to die from heart disease due to a delay in care from an acute event or a lack in preventing the progression of disease. And it's just disproportionately impacted due to a combination of reasons, some of those being genetic, environmental, and socioeconomic factors. One of the factors that is most often is higher rates of hypertension and having access to appropriate screening to have that hypertension controlled.
American medical colleges have found that only 4% of cardiologists are Black. What difference does it make when Black Americans don't have representation in the medical field?
It has been studied and documented since about the late 80s that there's increased compliance and cultural competency when receiving care from a care provider that looks like you. There's an increased level of trust that an African American will have with a fellow Black provider. And this is because of systemic racism that has occurred for some time that has marginalized the healthcare and othered African Americans when receiving care in our U.S. healthcare system.
So what is the biggest thing that can be done to make sure we bring this rate down?
Part of it is increased education and exposure opportunities to young Black students to see themselves as physicians going into the going into medical careers. And so it's really starting young, junior high, high school, with opportunities for clinical research or science programs so that many of these young Black students and other marginalized groups can see themselves becoming scientists, becoming physicians, becoming cardiologists. Once they see that they can get through the system, then our healthcare outcomes will continue to improve.
And what is your message to Black Americans to help reduce this rate of death?
I think the biggest would probably be education and not having fear to seek care. Many folks don't like to go to the doctor. It's particularly prominent sometimes with Black men, and some of it's generational fear, and it's appropriate fear. But you need to start taking control of your health. Your health is your wealth. And 1/4 or almost 1/3 of African Americans are affected or impacted by hypertension. So going in at least once or twice a year to get screened is important. Start medication early if you need to, and start to change your diet and your lifestyle to reduce your risk factors for developing heart disease.
Dr. Ferguson, thank you so much for your help today.
No, thank you.
Live on the KSL Newsline, Dr. Richard Ferguson. He's the president and founder of Black Physicians of Utah.